Hello, everyone, and welcome to our podcast. I'm Dani, and today Crate.com talks with Catherine Quinn, the Field Program Director at Concern America. If you hadn't heard of it, the Concern America has been working to transform need into self-sufficiency, bringing healthcare, clean water, education, and income opportunities to communities worldwide. Before we begin, remember, if you're new here to this podcast, press subscribe on YouTube or in your podcast app. Now, hi, Catherine, and welcome.
Thank you. Thanks for having me.
It's really my pleasure. I loved to learn more about Concern America during my research for this, so really eager to let more people to know about you guys. But let's start understanding more about your history. How did it all begin?
Sure. So Concern America, we're based in California, in Southern California, but our roots actually started in Ireland, and we just celebrated our 50th anniversary. So we've been around for a while. And sort of in a short version of our history, we began in Ireland. We are not a religious organization, but we did start with the roots of an Irish priest and other Irish nuns. And through that work have been we're in Bangladesh for some time, and often we're invited in the beginning to refugee camps to train local community members to become the health promoter practitioners, midwives, water system builders, teachers for their communities. And over time, have been then invited into Latin America. So we now have projects in Colombia, Mexico, and Guatemala. Again, with invitation, started with Guatemala and Colombia in refugee peace communities. And we're invited to accompany those communities back after the peace accords were signed or after some peace agreements were agreed upon in different regions, and continue the health promoter practitioner training, midwifery training, appropriate technology training.
Oh, that's really great. And I love how much you use the word invited, right? I think this is a key concept of what you do. And at this point, one of the things that really stood out to me was your approach. It's really quite unique, and in my perspective is really important, an approach of self-help and sustainability. Could you elaborate a little bit more on how this approach guides your projects and how it impacts the communities you serve?
Absolutely. Absolutely. As I mentioned, maybe a good example here is our work in Guatemala. So after the peace accords were signed and Concern America was invited to return back with communities, we agreed to return, but with the understanding that we would work with every community in the region. And why that was really important is to really start creating peace in regions. If we as an organization only were working with, for example, refugees or internally displaced, although very important, we wanted to make sure that every community was included in this to be able to also really make long-lasting change around health. And again, to build that community. So what we do in Guatemala, Colombia, Mexico is when we're invited in, we spend time going to the different communities and explaining that we are offering a 3-year training. So we want men and women to participate in this, and they come every other month for a week-long training. We have a curriculum. We actually sell our curriculum through Hesperian Foundation in San Francisco. And the training is all based on popular education. And at the end of this 3-year training, the people that have gone through the course are functioning at the level of a nurse practitioner, PA, and they are suturing tendons, diagnosing malaria, curing illnesses from contaminated water, and they become the practitioner of their communities. With the idea then that after their 3-year training, in between those months they don't come, we go and visit the health promoter practitioners in their communities to talk about cases and to start working alongside them so that their community builds that confidence in them. We don't see patients on our own. When I say we, I mean our field volunteers that are international. We have folks from Spain and Mexico and the US that are doctors, engineers, nurses. but always with the idea with everything we do, it's always alongside a health promoter practitioner or a midwife, so that the community gains that confidence in their local person. At the end of the training, we provide advanced courses twice a year for those practitioners and midwives. And now the project in Guatemala and starting in Colombia is at a point where the advanced health promoters are what we call multipliers, multiplicadores, and they are now doing the training and they are now doing the community visits. So at one point, Concern America had 18 field volunteers at different places, and now we have 10, with the idea that eventually we're not needed anymore and we'll move into another region. Even our advanced promoters in Guatemala now, we're sending to Colombia to train the Colombia promoters in things that they're learning in Guatemala, always with this idea that all the projects are connected and information's passed.
No, please go on. I'm just in awe here. I love it.
Really, a couple of really amazing examples of this is in Guatemala, the rates of cervical cancer and people dying from cervical cancer is incredibly high. And the health promoter practitioners and the midwives would see that women would go and get a pap smear, or there'd be a campaign to do pap smears, to never get the results back. And then even when they did get the results back and they detected cervical cancer, people just couldn't leave. It would mean them selling their land or selling a vehicle or a horse or whatever to be able to get treatment in a major city. So the health promoters themselves came up with now what's being followed in the World Health Organization of treating on site. So doing cryotherapy right when they see abnormal cervical cells. And so that those same health promoters have trained that same technique to those in Colombia. So different thing, that this idea of information and, concern really follows that community members know the solutions to their own problems. We just need to be able to provide training and tools to be able then to carry that out. So that's really a big part of what Concern America does. We do the same around water. Just looking at climate change right now in our world, we definitely see it in all the regions where we are, from a migration of people having to leave because they don't have food, because they don't have water for any of their crops, to which is actually a huge issue and continues to be. And now we're seeing malnutrition again in regions where we didn't before. So the health promoters really adapt to that and come up with solutions with their communities. When COVID first hit, here in the US, I think throughout the world, we've heard stories now of people being lost. We just didn't know what happened to them. Maybe not because they necessarily had COVID, but because they weren't able to go get their treatment for cancer or dialysis or things like that. But in every community where we work, there's a health promoter. So when things shut down and all transportation shut down, people they still were able to get their asthma inhalers, their treatment for TB, their diabetes medications, because the health promoter had what they needed there in the community. We follow the World Health Organization essential medicine list. So all the medicines that the community members have, after they go through the training and sign off on that they understand how to use these meds, they have botequín of medicines, and it's a rotating fund. So it's very inexpensive, quality meds. They're not donations in terms of like expired meds from other countries. They're good medications. And then with that money, the promoter comes back and purchases meds. So they always have those things in their communities.
Wow. I'm here thinking, because you brought so different areas of action, and all of them sort of orbitate around this concept of community resilience, right? It's about education, it's about healthcare, access to water, especially food, sustainable agriculture, and somehow, because food security is such an important point. And that makes me think of all the partnerships, collaborations you must need to keep this whole thing function. How is this structure of yours? How is Concern America structured in a way to make it all function?
Mm. So as I mentioned before, we're invited in. So we're really clear when we start a project. So I should say we're about to start a new project, and it's been 19 years, because when we start something, we accompany the process for a long time. Concerned, the funds that we raise for the work we do, we really make sure that it's broad, it's not all designated, so that we can move with pandemics and illnesses and things and growing needs of communities to have that long-term accompaniment. But we also do partner with local organizations, and we really base that off of who the health promoter practitioners, midwives, and appropriate technology and education promoters have confidence in. So sometimes we partner with ministries, local ministries of health, especially if they have a good relationship with the health promoters. In Colombia, we were invited in by the Catholic Church. So that's an entity in the region where we are that has really accompanied the communities and continued to accompany the communities during civil conflict. So we do a lot of partnership in that way. But I will say that during COVID, there was a lot of organizations that pulled out for very obvious reasons. I mean, no criticism there. We totally understand. But Concern didn't pull out because we have local people there. So our work continued. All the field volunteers stayed. And our partnerships with some local smaller groups too meant that we can continue providing quality healthcare and addressing the issue of COVID. We were able to purchase 3 oxygen machines. They're portable that recycle air. And so just being able to, in communities, promoters could take those oxygen machines and just having oxygen, which is what we saw later on in the pandemic, to communities, entire families. They were able to save many lives that way. You know, keeping in mind the communities we work, some of them are 12 hours from a major city or hospital. Even if you get to the hospital, there may not be materials there. So just that.
Yeah. It is an impressive work that you're doing, honestly. And again, the highlights you bring, the fact that you're able to act locally, it makes a whole difference. Absolutely. But still, even with all of this, I imagine that there are a lot of challenges that you face like daily. Which ones do you see more often, or the ones that weigh more on you?
I think always, you know, in all the regions where we are, there is, there continues to be violence, land reform and lack of access to land is a huge issue. So that really impacts the families and communities we work. I think our global migration, immigration crisis that we're in, we're really seeing that in a lot of the communities where we work, the increased violence around that, on migrants that are, people that are trying to come to a safer place. And I think the continued need for quality healthcare and increasing lack of clean water. And so all of those things make for a lot of challenges in all of the projects. But I'm always of the solutions that come out of all the team meetings about how to address these situations. So they're hard and they're challenging, but then there's this other piece of, I would say, incredible hope of people doing what they do because it needs to be done. It's just, everyone just says, well, we got to do it. When there was, even now we're seeing a lot of in Colombia and Guatemala and parts of Mexico with the lack of water. And again, I mentioned just food scarcity, the promoters themselves, who everyone that we work with, the majority are farmers themselves. Many don't have more than a formal 3rd grade education. And many promoters may not know how to read or write. And they know the importance of learning that, of being able to be the healthcare providers in their communities, because if they don't do it, then no one will. And that's really although there's so many stories that are hard, just, this is what we're going to do. Like, we're just going to make it better. And I feel that resilience and just love for community really comes out, even though there are so many barriers at different times.
Yeah, I honestly take from this knowing Concern America, I think the word is truly resilience, right? I think that's what resonates the most in my head. And to everybody watching or listening to us right now, I want to encourage you to go to their website. We are here trying to just talk about some of the things that they do. You can get information about this beautiful history that they have been building for over 30 years. Actually, more than that, right? 72, you mentioned, it's a really long time. At their website, it is concernamerica.org.org. Please, guys, go there and check it out. You can actually maybe identify yourselves with some of the things that you're doing. And if you can help out. And that is my final question for you today, Catherine. That is, what are the best ways for someone that's not able to help locally help you still keep going?
Absolutely. So just to give some numbers that I think are really incredible, it costs $1,000 for us to train one health promoter for 3 years. That's all the materials, their meds, the training, the transport. Think about what people pay to go to become a doctor or nurse practitioner in our communities. And it's $100 for a water filter for a family. And that water filter is a small thing that they attach into a bucket. And definitely in areas where we work, where sometimes people have to flee, they can take that water filter and take it with them. Those are two things. So I put that amount of money to an actual thing. Honestly, to be able to donate means that then those funds can go into the work that the promoters are asking us to do, as opposed to bills. Those are real, and you can go onto our webpage, and it's very clear how to donate, and there's a lot of information of where your funds go. And we're really proud of just being very transparent about where our money goes. We're a small staff. There's only 6 of us, so you can feel confident that that goes to the field. The other little plug I want to put is that we are looking for field volunteers currently. We're looking for doctors. We're looking for a doctor to volunteer in our project in Colombia and a doctor to volunteer in our new project that we're starting in the communities outside of San Miguel de Allende in Mexico. And our promoters, our volunteers, we ask for a 2-year commitment, and we provide transport, health insurance. We take good care of our field volunteers as well. So 2 plugs, if you know anyone that would like to volunteer, but it is long-term volunteering. It's not just for a month, it's for a 2-year commitment. Most of our field volunteers stay with us for 20 years because they love the work. So
that's great. And just to give more information, are there any requirements for these volunteers, or no?
So currently, the 2 positions that we're looking for, we are looking for a doctor, nurse practitioner, or PA, preferably that's bilingual in English and Spanish, or Spanish in another language. And that's probably the biggest, and who can give 2 years service. Usually we ask for people that are over 21 years old. But other than that, and at times right now, we're currently not looking for anyone, but we have had engineers as field volunteers because of our water project work that we do. We also trade artisan cooperative work. So in the past, we've had different with us, to help the cooperatives when they've asked for new designs of things. So you can just reach out to me. I'm the coordinator of all of our field programs. So if people have more questions, they can email me. You can find my email on the concernamerica.org webpage.
Perfect. Thank you so much, Catherine, for talking to us today. I learned a lot. Thank you very much.
Thank you so much.
And for everybody listening to us also, thank you for staying with us for one more episode. And remember, if you like this conversation, press subscribe on YouTube or in your podcast app, because that shows the algorithms that this is an important conversation and more people can learn about the importance of the Concern America. Go to their website if you can, donate if you can, or volunteer. And well, I see you at the next episode. Bye.